Coordinator at Nepal Public Health Foundation. On behalf of our organization, I would like to extend a warm welcome to you all to the Global Health Network Seminar, Building Health Research Capacity through Networks, organized by Nepal Public Health Foundation in collaboration with Nepal Health Research Council. Now I would like to request everyone to stand for our national anthem. Nepal Health Research Council to please come to the stage and take their respective seats. I would also like to request our chief guest, Dr. Bahadur Shrestha, Vice Chairman of Nepal National Planning Commission, to join us on stage and take their respective seats. I would also like to request our guest of honor, Professor Trudie Lang, Oxford University, the Global Health Network, to join us on stage and take their respective seats. I would also like to request Dr. Kumar Govindakarnavar, Executive Chief and Founding Chair of Nepal Public Health Foundation, to join us on stage. Now I would like to request our speakers to join us on stage and take their respective seats. Now I would also request our guest from WHO Health Emergencies Program, Professor ArunKumar Govindakarnavar. Now I would like to proceed to requesting our speakers to join us on stage. Dr. Sangita Kaushal Mishra, Additional Health Secretary, Ministry of Health and Population. Mr. Manoj Bhatta, Member Secretary, Social Welfare Council. Dr. Aliya Naheed, ICDDRB, the Global Health Network Asia. Thank you. Nepal Public Health Foundation was established with a mission to have concerted public health action, research and policy dialogue for health development, particularly of the socio-economically marginalized population, with a goal to ensure civil society's proactive intervention in public health. On this occasion, the Nepal Center of the Oxford University Global Health Network will also be launched. NPHF will host a center whose objective is to facilitate health research collaboration, among health landscape to please deliver his welcome speech.
Dr. Arunkumar Professor Dr. Chief Guest, Honorable Dr. Bahadur Shrestha, the Vice Chair of the National Planning Commission. Keynote Speaker Dr. Vasee Moorthy, the Senior Advisor for Health Research, WHO Geneva. Unfortunately, he is not here physically, but he will join us virtually in a recorded speech. Dr. Trudie Lang, the Professor of Oxford University and Head the Global Health Network. Dr. Manoj Bhatta, Member Secretary, Social Welfare Council, Nepal. Dr. Sangita Mishra, Additional Secretary, Ministry of Health and Population. And Dr. God his name, but he is representing Dr. Rajesh Pandra, WHO represented Nepal. And Dr. Aliya Naheed, the lead of the Global Health Network Asia. Distinguished guests, participants, colleagues, and media personnel, a very good morning to you all. It is my pleasure to welcome you in Global Health Network seminar organized by the Nepal Public Health Foundation in collaboration with Nepal Health Research Council. I am really thankful that this seminar is graced by the presence of Honorable Dr. Bahadur Shrestha, the Vice Chair of the National Planning Commission, as our chief guest. And I am particularly delighted to welcome our distinguished guest in our beautiful historic and cultural valley of Kathmandu, where in the area of 220 square miles reside 7 World Heritage sites. Among the audience, I am seeing Vice Chancellors, deans, and our distinguished guest, the National Planning Commission, the Honorable Member who is who is looking after their health matters, and former ambassadors who are also physicians. I'm seeing those are also sitting there, and very distinguished personality of public health, Dr. Dr. Sangita Kaushal, Dr. Bahadur, all these people. I cannot name all, but I'm seeing very distinguished people in this hall. So I thank you all. And the impressive presence of you all, despite of your very busy schedule, is a testimony that we are at the cusp of recognizing how important research is and how urgent is the need to join hands for good quality research. The theme of this seminar is building health research capacity through evidence. We are increasingly realizing the importance of research for evidence-based policy formulation. Building health research capacity is vital for generating scientifically valid evidence, and the networking of academia, individual researchers, research institutions, government health care system, and communities are essential for building such capacity. The Global Health Network, under the leadership of Professor Trudie Lang, has taken impressive stride towards that direction in a global scale. Now it has 3 regional centers in Africa, Latin America, and Asia. The TGHN Asia lead is Dr. Aliya Naheed, who is in the dais today. We have been collaborating a WHO Collaborative Center also. Today is a special day of this collaboration because today we are launching the Global Health Network Nepal Center, hosted by Nepal Public Health Foundation. The networking of all the stakeholders mentioned above, and it will be able to link with a larger body of research community from Oxford University to ICGDRB Bangladesh, and many other eminent universities of Asia, Africa, Latin America, and Europe. Financial resource is vital for any research endeavor. Joint research proposal bidding for global funding is one way to address it. It will also raise the issue of 90-10 gap in health research funding. That is, in general, 90% of the research fund allocation goes to global north, while only 10% of global goes to global south. Both WHO and TGHN have been raising this issue, and the time has come to take a serious note of it. In Nepal, the Nepal has recently decided to earmark 1% of development budget in research and development and innovation. Progress toward health-related goals of SDG is not possible without enhanced capacity of health research. We have joined hands with Nepal Health Research Council for the task of building research capacity and networking. It is symbolic of that cooperation that we are collaborating to organize in this event together with Nepal Health Research Council. Because of some conflicting priorities, I told you already, Dr. Moorthy could not be present here, but he delivered his speech online. And with these words, I welcome you all once again. I hope our distinguished guests will have a very pleasant escape and enjoyable time in Nepal. Thank you.
We will now be proceeding to the inauguration of the program. I would like to request our chief guest, Dr. Bahadur Shrestha, to please do the honor of lighting the panels. I would like to notify that our keynote speaker, Dr. Vasee Moorthy, Senior Advisor, Research and Development, WHO Headquarter Geneva, unfortunately was not able to be present with us physically, but he has sent us a pre-recorded video and he will be attending through Google Meet.
I'd like to give you some thoughts from my perspective, having worked for the last 25 years ago, in how some of the emerging trends that we see may be most relevant to you as you set up the new activities and initiatives that are planned in Nepal. I would like to meet with all of the stakeholders in Nepal. I still somehow haven't made it to Nepal despite many visits to India and China. So just some very high level background. These are big.
Thank you, Dr. Moorthy. Now I would like to request our guest of honor, Professor Trudie Lang, to please deliver her speech.
For inviting us to Nepal. I'm here with my colleagues Aliya and Aliya, who you'll hear from later. Thank you, Manoj. It's been a pleasure getting to know you and your colleagues over the last few years, and we've talked about this for a long time, so it's just such an exciting day. So personally, I was in Nepal nearly 30 years ago. For the youngsters in the room, please don't count, but I'd begun my career already at that point working in infectious disease and health research. And since that time, I've really begun to think about some of the issues we're going to talk about today. And whilst I began my career working in clinical trials in infectious disease, it was really clear to me that lots of the barriers we were facing and the difficulties already working in India a lot at that time and in Africa, that we were facing the same problems of putting research systems in place. And I'm just really delighted to follow Vasee this morning because he and I have worked very closely together. He and I actually began our careers in the Gambia working on malaria, and it's delightful to virtually at least share a stake with him because we're both now working in a much more disease-agnostic way to try and really support research capacity across the globe. And what I really want to focus on today with you all is how, is moving into practical, how do we do that? And we talk about networks a lot, but what does working as a network really mean, and why should we bother? You know, what is the advantage of working in a network? The advantages are we can learn from each other, and that we can transfer knowledge and know-how. And what I'm going to talk to you about later today is the evidence we've got on why that will work, and how we know that the barriers are similar. But there's a positive, you know, the enablers are similar as well. And there's so many global initiatives that Vasee lists some that the WHO are leading, but there's so many more happening across your neighbouring countries, across the region, but across the globe. So we came to you today for a meeting in Delhi, and there are a few people in the room joined us, and that meeting was set up by Welcome as one of the funders, but the goal of the meeting was to go beyond that and have lessons that could be transferred, not just to any funders, but to governments and policymakers, but us as the research we're doing, and then also what the barriers are to doing that research, but also to share some of your solutions. Now, we had that meeting in Delhi. That meeting is going to be repeated in Rio at the beginning of next week, and then be repeated again in Addis at the end of the following week. And I'm going to ask Mahesh and colleagues to share the outcomes of those discussions with you all, because what we're seeing already is the findings don't differ, and that's my point. Everybody's pretty much agreeing on what the research priority disease is, and Vasee made a really important point in his talk about the need to work on the whole ecosystem of health research. And I'll talk about this more later on, but we shouldn't just focus on clinical trials. And I say this as my whole career as a clinical trialist, really, about how we need to make sure we cover the whole ecosystem. And I really will talk about that later. So let me come back to the how, because we're here not just to talk. Mahesh and I have been talking for 3 years. This is doing now, and working together as friends and colleagues and collaborators. So, research needs to begin in the community. It needs to begin with your patients, but the wider community as well, because we're talking about diseases that might occur, or burdens that we want to prevent even before they happen. Those questions need to be set in the community by the practitioners, by the policymakers, by your community themselves. And then that way we can plan research that can address the most pertinent questions. And again, as Vasee alluded to in his talk, it doesn't always need to be a multi-million, gazillion-pound vaccine trial. It can be really pragmatic research. Soumya, who was Vasee's previous boss, who works, she's a very dear, respected colleague. Soumya Saranapan is head of research group in WHO. She always used to talk to me about research should be measuring what's in front of you, and also talked about building research systems and health systems. And I hope what we can do over today and the coming weeks, months and years as we work together is really work to think about how we can place research systems into healthcare systems. And that means working through that whole starting point from the community, working with the community throughout the research and bringing it back. Taking the research to policymakers, but also bringing it back to the beneficiaries that the research was designed for in the first place. I also have a fundamental belief in training in the workplace, not taking people away to do a PhD in a distant country, and not training the PI or the big gov at the top. We need to train everybody. We need to train community health workers, laboratory staff, pharmacists, everybody, and bring the point that research is for everybody, and everybody should be championed to do research. And I'm going to talk to you later about a particular project that we're going to be focusing on with nurses and community health workers that I hope everybody might be interested in embracing. And I believe we're going to talk to the nurses tomorrow. So here I am with you in Nepal, and it's just such an honour. And as I said earlier, I was in my early 20s and spent a wonderful few weeks climbing and exploring the mountains. But here I am back in my professional capacity talking to you all as colleagues. We're going to talk today about what we can be doing in Nepal to connect up research. You know, what we often see is that the networks or the projects that exist focus on one disease or one area. So even within our hospitals, we can have areas of really huge research expertise in one particular disease area, usually because one team has become a research leader and they're funded, and we have a centre of excellence. You know, I've got my Oxford colleagues in the room here for the Oxford Research Unit in Nepal. It's an amazing centre of excellence, and we need to transfer that expertise into other areas where maybe not so much research is happening. And that's for you to think where that is. It could be orthopaedics, it could be maternal health. Where are the research gaps? Where is there a lack of research capacity? So we're going to be thinking about how to implement that in Nepal. But what we learned this week in Delhi, and what we've been working on for the last 15 years with the Global Health Network, and I've known for my whole career, and you all do too, is that these barriers are the same, and it's all about equity. Equity and access to training, to opportunities, to awareness, but also in the mandate to do research, and I'm going to come back to that later, and I really appeal to our colleagues here from the government, from heads of universities. Research training is just so important, and we're going to have some really practical ways to do that. But healthcare workers need to have the mandate and the support to do research. One of the biggest findings that came out of the work we've been doing with Welcome about barriers to research was institutional support to everybody to think that research is something that they can be responsible for. So we're going to spend today and the rest of the time we have in Nepal really setting some plans in place, and I just invite you to stay involved and work with us. And hopefully together we can address some of this inequity and create opportunities to become researchers, but most of all to build that visibility within Nepal and the region as research leaders. And nobody can do that alone, and you need to build whole teams, and then we can work as networks across and within Nepal, but across Asia. And the whole point of the Global Health Network is to connect you with your global colleagues across Africa, Asia, Latin America, everywhere, to share the expertise, and that's what I'm going to come back to later on the real how we do that. So thank you again for welcoming us to your beautiful country. I wish I was here for longer, but I'll be back again, I promise. But thank you very much.
We've allocated 8 minutes each for each speaker. So I would like to request our guest speaker, Mr. Manoj Bhatta, to please deliver his speech.
Respected Chair Dr. Bahadur, Chief Guest Honorable Dr. Bahadur Shrestha, National Planning Commission, Special Guest Honorable Dr. Mishra, Dr. Vasee Moorthy, WHO Headquarter, Professor Trudie Lang, Head of the Global Health Network, Dr. Sangita Kaushal, Secretary, Ministry of Health and Population, Dr. Manoj Bhatta, Founding Chair and the Executive Chief of the Nepal Public Health Foundation, all the respected dignitaries, ladies and gentlemen, it is an absolute honor to be invited and provided with the opportunity to share the inaugural ceremony of this important forum. On behalf of Social Welfare Council, I extend my deepest gratitude to the organizer and everyone here on the podium before me and those who are participating remotely. Thank you very much. Before I begin, I would like to emphasize on the initiative or the program aimed at enhancing the research capabilities and the collaboration within the field of health system strengthening. Health system strengthening involves the improving the overall functioning and the performance of a healthcare system to provide better health services to the individuals and the communities. The specific objective of the initiative research related to the health system strengthening. It recognizes that robust research is the crucial for the evidence-based decision making and the policy development in healthcare. The program typically involves the establishment of the networks or the partnership among research institutions, universities, policymakers, and the other stakeholders working in the health system strengthening domain. Collaboration. Respected Chair, now I would like to focus on the research collaboration. Many of the global agencies have consistently emphasized that the primary function of the sustainable knowledge system is to create and continuously improve the human and the physical resources for health research. Developing the capacity to effectively carry out the researchers are working increasingly in collaborations to address complex research issues. Higher education institutes are focusing more on providing incentives to researchers to take part in international collaboration projects. Funding agencies also give emphasis on the collaborative research as it can draw diverse expertise, promote creativity and innovation, and therefore lead to the scientific breakthroughs. There are different reasons for researchers to collaborate. First one is collaboration has become increasingly necessary for researchers to address the complex research issues that otherwise cannot be addressed only by individual researchers. Second one is collaboration is important for researchers' sustainable development in knowledge creation. And third one is the collaboration may reduce the research cost. Research collaboration finds that the experiments tend to collaborate more than theoreticals. By building research capacity and fostering collaboration, the initiative aims to generate evidence that can inform the design, implementation, and the evaluation of the interventions to strengthen the health system. Another focus is on the research capacity building. An institution needs the 6 fundamental building blocks to foster a scientific research culture: capacity building, infrastructure, leadership, funding, incentives, and collaborations. So, research capacity building is a process in which individuals, groups, and institutions enhance their abilities to mobilize and use resources in order to achieve the objectives of a sustainable basis. In the context of the research capacity, it refers to the ability to conduct the research sustainability. Research capacity is a key to both the survival of the higher education institutes and the attainment of the institutional missions, as the funding of the higher educational institutes is increasingly tied to the performance measured by the research productivity. For example, scholarly research articles and the impact. Research, another one is the research collaboration network. Various factors in collaboration can increase the likelihood of knowledge creation and thus research productivity. Research collaboration networks can play an important role to bridge the knowledge flow among researchers in and among the institutions. Research collaboration networks may also enable organizational development. There is a need to emphasize how research collaborations influence the organizational development, the amount of interactions, the similarity of beliefs and attitude, and the affirmative ties are interrelated. As researchers collaborate, they develop common meanings, beliefs, and the mutual understanding. So, lastly, research collaboration networks may also support the development of the inter-organizational collaboration and engagement. We also look forward for exploring new avenues of the partnership and collaboration that are driven by the most robust, productive, and the regular technical assistance to help us realize our growth potential. Our shared knowledge will certainly benefit from our shared vision and prosperity and partnership in the days to come. I think this is one of the important flows that may create the collaborative research network in the days to come. I thank you, respected Chair, once again for this opportunity. Thank you very much.
Thank you, Mr. Bhatta. Now I would like to request our guest speaker, Professor ArunKumar Govindakarnavar, to please deliver his speech.
A very good morning. Today I am here on behalf of Dr. Rajesh Sambhajirao Pandav, the WHO representative to Nepal. He could not come here because another regional meeting is happening at the same time. He conveys his best wishes, good wishes to this important meeting. Respected Chair Dr. Trudie, Chief Guest Dr. Bahadur Shrestha, Dr. Manoj Bhatta, Dr. Vasee Moorthy, Professor Trudie Lang, Dr. Aliya, Dr. Sangita Mishra, Additional Secretary, Ministry of Health, Mr. Manoj Bhatta, respected Madam Dr. Rita Thapa, the WHO champion for the WHO 75 year celebration from Nepal, respected Vice Chancellors, Deans, researchers, other colleagues, ladies and gentlemen. It's a pleasure to be part of this meeting. As we all know, the importance and power of networking or networks in research, practice and policy cannot be overemphasized. We have experienced that in responding to COVID-19 pandemic. We continue to experience that because pandemic is still continuing. My previous speakers also emphasized the importance of research networking and enhanced collaboration for increasing the research productivity. It's a well-established fact. So research networks are very important to elicit quality evidence in short time. We have seen that during COVID-19 pandemic, how the evidence is being generated through collaboration of different countries. So, however, we know that it's very challenging. The collaboration is also very, very challenging because the relationships and human factors are very important in collaboration. We know that many times academicians, we are not even trained to how to deal with people. So many of the collaborations just fail because we don't know how to deal with it, because we think that a research protocol is written, a research council has approved the protocol, it will happen, it will not happen. We really know that the studies have really explored why people in networks sometimes do and sometimes do not do, invest time, energy and efforts. So we need to understand that why somebody should be part of the network, what benefits they get. Because most of our research, even networking, we say it's some sort of a helicopter research, Somebody comes from somewhere to research. Whether the country benefits from that or not, we don't know. We also should understand that, as I'm quoting from a Hungarian Frigis Karinti in 1920, he said, quote, "We are all joined by 6 degrees of separation." That means each one of us is maximum 6 shake hands away or 6 handshakes away. For example, first time I'm meeting Professor Trudie, but we are only just 2 handshakes away, because I know I'm very close to Dr. Vasee, and she and Vasee studied together, they work together. So this is how the relation, so we have to utilize this to bring these networks work better. So basically understand the people dynamics, this is very, very important. Because everybody will come forward provided they benefit. The moment they understand that they benefit, they will come forward. Otherwise, and the trust is very, very important. Because we are living in a particular period of time where trust, the people try to cheat and etc. So we have to be very careful in designing studies. So more work needs to be done to identify how the networks can be made more efficient and what are the specific indicators we need to address. And we know that international collaboration is growing exponentially in the last few years. Researchers from different institutions and countries. Today in this room itself we have researchers from different countries sitting together and forms consortia. Consortia can be very effective provided it is managed well. So there again many times we find that even national level consortia we form, we are part of member of the consortia, but consortia efficiency is not that good. Because each individual or institutions comes together in consortia, they always try to be very, very protective of their identity, not willing to give an inch. But if you do not collaborate properly, manage the collaborations properly, the efficiency will not improve. Establishing research networks, collaborations, and including non-governmental organizations, non-profit organizations, voluntary participants or groups provides the flexibility. We need to be more inclusive to make it more happening. Because there are even disease-specific associations are there, the people living with HIV, AIDS, etc. Such organizations are also part of your network. It's much easier, much efficient to get the research output more quickly. So, health research network enable the final mile. For example, you are doing a clinical trial. If you have your manufacturer, your health researchers in the academia, and the community organizations and researchers in the countries all together, then you can complete the circle. That's what Vasee was telling, that it's a cycle. It's not a straight line. So we need to be aware of that. Producing health care policy, we depend on power of the network, because that's where it's much more better research than individuals doing, because it's much more believable, because there are peers are reviewing it and it's coming from a collective wisdom. So the COVID has given an opportunity in WHO also, the solidarity trials. Solidarity trials where multiple countries are involved. I'm happy that Nepal was also involved. Quickly, we come up with a, recommendation, something that, okay, somebody said that remdesivir is good drug, but quickly we could say that no, this is not good drug, it is not adding value, because of the collaborative research involving multiple countries and multiple researchers. Similarly, hydroxychloroquine, we know that, because of that, the strength of the evidence, and quickly WHO and other countries could change the policy. So, I am also happy to mention that the 75th WHO World Health Assembly has adopted a resolution. It's called as WHO 75.8 Clinical Trial Resolution. Earlier, WHO was more into developing normative standards and guidelines. But this resolution entrusted or asked WHO to support countries, member states to improve infrastructure. So if you wanted to collaborate, for example, Nepal wanted to collaborate or wanted to be part of an international clinical trial network, Nepal should have that capacity. So we should invest in developing that capacity. I am very sure that Nepal is very forward in many of these things. We have people, we have institutions, but we need a little push to develop that capacity. With that capacity, Nepal can be part of these global networks and contribute. And many times, often, we rely for policy development, the evidence generated in other populations, evidence generated in other countries. But we should now focus on developing evidence from our own population, our own country, which can contribute to the others also. We can take it from others, but also adapt it to our local context, and which will be much more useful. So, hence, from WHO, I call upon the researchers in Nepal to be increasingly involved in collaborative research and prepare their institutions for being part of the health research networks to effectively address Nepal's health research needs. WHO Nepal Country Office stands ready to support Ministry of Health and NHRC and Nepal Health Foundation and other organizations in Nepal who are doing very wonderful work to build the Nepal's research capacity and build the Nepal's networking capacity, including the infrastructure development. I wish this meeting all success, and thank you so much. Thank you.
Thank you, Professor Govindakarnavar. Now I would like to request our guest speaker, Dr. Aliya Naheed, to please deliver her speech. Nepal, and good morning everybody. This is a wonderful opportunity to start my first ever morning in Nepal with this wonderful program, my first day in Nepal. So this is a great moment for me. Respected Chair, today's chief guest, special guest, guest speakers, distinguished delegates sitting on the podium and in the audience. It is indeed a great pleasure to be invited to this important program that Dr. Manoj and his teams have put together and invited me. I can already see the network has already been started building, and the whole concept of the seminar is building health research capacity through networks. And I'm also impressed to see that Manoj is not alone. We already have joined him in building the network, and that says what a great demand and interest already lies in this community. And I can see this is probably only the tip of the iceberg of Nepal, where researchers are working relentlessly, and they are trying to do good, benefit health, being benefit to health of people in Nepal. You probably already know that because of the advent of science, technology, and better education, and of course, digitization, our education has gone to a very high level in terms of quality. And because of these better resources, the developed countries and communities and groups have a better opportunity to do better research. And we are in a race. Science cannot be compromised with quality. But because we do not have the right resource, right skill, right infrastructure, and the right kind of training in research, we the people sitting in the developing country in the global south, including Nepal, Bangladesh, Bhutan, and any country you can name in the Latin America, Africa, and Southeast Asia, they are suffering from becoming more research-intensive institutions. Why are we doing research? Are we doing research for publishing results and being famous? Maybe that was the day, maybe 25 years back or 50 years back. But now research has become a part and parcel of improvement of health and technology. So with this huge number of people's good health, how can you think of development of your own country or our own countries? But very important that we never recognize that our health workers are actually doing innovations in their everyday professional life. And our previous speaker touched base that they have made so many innovations during COVID, and that was only possible because they were allowed to do many things they were never allowed to do. But when we were looking at the papers, looking at the reports, we were being a little bit critical. Oh, the research method was not fine, their analytics were not up to date. And some of their documents were rejected. It's so important that whenever someone is doing research, it is so ethical that it gets published, because information that is generated in a country like Nepal will be an example and excellent information for other countries who do not have the resource to do the same studies in the near time. But these little scientists, they're sitting in our fields, in our communities, in small hospitals, in small clinics. They are always remaining unrecognized because they do not document. They don't know how to write it and do not know how to present it. So it is really important to measure what they are doing and how to measure the benefit and then present it to the global community, at least at the national community, so that people in the country, they are well aware there are good practices, innovations, and those can be adopted by others. But who will do that? The question is that such a big community such as Nepal, so many health workers working at the field level, in the community, in the hospitals, in many other organizations and private sectors, they are dealing with health. But who will train them to become researchers, but not to become professional scientists, but to do better research in their daily life? We probably cannot think of a single organization. And you can think of many organizations. And that is a problem. So how we do that? We cannot be limited to one country anymore. As our previous speakers all say, the benefit of global networking, and the name of the bigger organization is the Global Health Network. So this is the whole idea, that how we can put the researchers and health workers of the global south
to a network that's connected to all parts of the world, particularly to the better resource communities who have better skills, and we learn from them. And this is where the Global Health Network Asia has encroached. We have joined the Global Health Network to create this regional hub. And our goal is to bring each and every country in Asia to create their own network, such as Manoj has already started in Nepal. And I'm very, very proud to announce to you that Nepal will be the first country to join as the country hub of the Global Health Network Asia. And we are so proud that we could be here personally and physically to observe that. And it is also a risk because you are also going to show the whole world of how this can work, and other countries will learn from the experiences of Nepal. So it is really very important that the brilliant minds sitting in this audience, they are connected to many other brilliant minds. You work together and come together under the platform of the Global Health Network Nepal, and you actually allow us to reach you. And I'm not going to tell anything more elaborately what we will do under the Global Health Network Asia in collaboration with the Global Health Network Nepal now, but I will speak about it at a later part of the day. So I would request you all to be there so that you know how the operations will go on. But it is really important today that we have started the journey, and I believe within 2 weeks or within a month, I will get a very long list from Nepal Public Health Foundation with the names of all the interested institutions, both formal research institutions and informal healthcare institutions who have expressed interest to learn research, to do research. Our philosophy is learning research by doing research. So we are not the network to provide the funding directly, but we are the network to support the Nepalese researchers to Nepal Public Health Foundation so that they can learn the basic skills in a very high level, so that your research documents are not rejected by the high qualified committees in the journals or in the grants, sitting in the grants, who will see with your proposals of research. So with these very few words, I again like to convey my heartfelt gratitude to Nepal Public Health Foundation for taking this risk, to take the leadership to run the Global Health Network Nepal in collaboration with so many high-level institutional and professionals, including international organizations as well. Thank you very much.
Thank you, Dr. Naheed. Now I would like to request our guest speaker, Dr. Sangita Kaushal Mishra, to please deliver her speech.
Respected Chair of the session, Dr. Obredi, Chief Guest, Vice Chair of National Planning Commission, distinguished guests on the dais, as well as all the distinguished and esteemed guests in this room. First of all, it gives me an immense pleasure to be a part of the inauguration of Global Health Network. I would like to congratulate Nepal Public Health Foundation for leading this network and NHRC for being a part of it. I really feel very much tongue-tied when I look at the audience in the room who have spent most of their lives or most of their professional journeys in the part of research, and I really feel very apprehensive to say a few words. However, I would just like to say that we all understand the importance of research and collaboration. When we look at the current scenario in Nepal, we know that research is in a very nascent stage. Although some of us have done very good, very robust research, but still we understand that we have a long journey and we need to look ahead. The other thing which comes to my mind that when, as Dr. Aliya was mentioning, that we never recognize or we fail to recognize the work of the community researcher or the people who are community health worker who don't know how to build up on their research or who don't know how to write up their research. With this platform, I just want to say that in the field of social sciences, we have already started valuing this barefoot researcher. So that concept of barefoot researchers has already came to Nepal in the source sector of social science. So I would like to call upon everyone to help these barefoot researchers in health as well, which will give us some of the policy directions and some of the innovation which is going to help our country to achieve our health goals. The other thing is that establishment of global health network with the help of NHRC and NPHF is very timed, as this network is going to help us in improved collaboration and knowledge exchange. We all know that we are doing research, but when it comes to the translation of that research, sometimes we are lagging much behind. My understanding in the field of research is that we do research for the benefit of community, but when it comes to the dissemination part, sometimes we just disseminate all these results in these big forums, and the communities on which we were doing research, they are left behind. So maybe this is I would just like to indicate that we should be disseminating our results to the communities, because we have done research for these people. So that would be one of my requests to this network, and I'm sure that this network is going to do that. The other thing, we are very much like defined in health. Although all of us in this room, we know that health is beyond health. So I would like to again reiterate that it is the time for working together, and it is the time when we should encourage multidisciplinary health research, because the concept of health in all has already come up, and I feel that we need to start doing this multidisciplinary research. The other thing is, we would need, this network will definitely help us in identifying the structures and the capacity and the barriers in the field of health research. On the other hand, we all know that Nepal has its international and national commitments to meet. So I'm sure that this network is going to help us, or it will drive Nepal to find out our health research agendas to help us meet our SDG goals. We have only 7 years to meet our SDG goals. So this will help us in identifying our priorities and identify our interventions in that direction. The other thing I just want to say, that when Dr. Arun was saying that there is a power of network, I must say this is the most difficult work. And I see that NPHF has a very daunting and a very challenging task on this, because doing collaboration and doing coordination is one of the difficult tasks in this world. And I must say good luck to Dr. Maske for doing that. And I'm sure that he will be able to bring everyone together at one platform. So at the last, I would just like to say that let's all focus on the health disparities and not forgetting. On behalf of Ministry of Health and Population, I would like to commit all the possible support from the government to this network, and I'm sure that this network will help Nepal in building capacities, which will bring everyone together and in achieving our international and national commitments. With this, I wish you a very successful deliberation and wish you a very happy day. Thank you so much.
Speakers for gracing us with your profound insights and expertise. We will now proceed to the next segment of the seminar, which is launching of the Global Health Network Nepal. I kindly request our chief guest, Dr. Bahadur Shrestha, our respected chairs, Dr. Aliya Naheed and Dr. our guest of honor, Professor Trudie Lang, Dr. Aliya Naheed, and everyone else on the dais, to please do the honors of officially launching the Global Health Network Nepal.
अलिकति ब्याग जानु
Shrestha, Vice Chairman of National Planning Commission, to deliver his speech.
Distinguished personalities on the dais, esteemed speakers, participants, ladies and gentlemen, Namaste. I am very pleased to be here with you in this inaugural session of the Global Health Network Seminar on Building Health Research Capacity through Networks. I would like to thank organizers for organizing this important seminar and inviting me as a chief guest. Without scientific health research, we cannot formulate evidence-based health policies. Building health research capacity is central to achieve this task. The topic of the seminar is very pertinent and timely, not only for Nepal, but also for the regional and international cooperation as well. The progress towards health-related sustainable development goals is possible only when we strengthen our research capacity. I listened attentively to the speeches made by Dr. Vasee Moorthy, Senior Research Advisor of WHO, Professor Trudie Lang of Oxford University and Founding Chair of the Global Health Network, Dr. Aliya Naheed of ICDDR, Bangladesh, and the Global Health Network Asia League, and other distinguished guest speakers. I am impressed by the range of ideas deliberated in these speeches and fully concur with the speakers about the importance of networking of academia, researchers, and government institutions for building health research capacity. I also learned that Nepal Public Health Foundation will host the Global Health Network Nepal Center in Kathmandu. I think just inaugurated. I think Nepal Public Health Foundation is well suited for this purpose, as it is Public Health Foundation is well suited for this purpose, as it is one of the most acclaimed and reputed public health research organizations in Nepal, established by distinguished public health professionals. I believe that the center will greatly contribute to building the network for health research. Since its establishment, Nepal Public Health Foundation has worked closely with the government and academia, conducted health research and published in scientific journals in collaboration with renowned universities of Europe, USA, Africa, and South Asia, and played an important role in shaping COVID pandemic preventive measures and management. Just 2 months ago, I also had the honor of attending Nepal Health Research Council's national event as the chief guest. Nepal Health Research Council is the apex government body to oversee health research in Nepal. I am happy to say that Nepal Public Health Foundation and Nepal Health Research Council have joined hands to build health research capacity through networking of all who are involved in health research. Health is in fact a cross-cutting sector, interrelated and interdependent. Hence, we need multi-sectoral approach to deal with health problems. National Planning Commission's one of the objectives is to oversee how this multi-sectoral cooperation can be achieved. In health research also, this multi-sectorality is being explored, particularly when the research focus is on community. When we address or search for health, we are also doing the same for education, agriculture, and environment. Honorable Member of National Planning Commission, Dr. R.P. Bicha, is here, who oversees the health sector. I would suggest a meeting with Nepal Public Health Foundation and Nepal Health Research Council leaders to chart out a roadmap for building networks for health research capacity. Academia, WHO, and UN agencies can also be part of such process. I want to assure that such effort will have full support of National Planning Commission. With these words, I wish to...
Thank you, Dr. Shrestha. Now I would like to request Dr. Meghna Dhimal, Senior Research Officer of Nepal Health Research Council, to please join us on stage and deliver his vote of thanks.
Cheers of the sessions, distinguished chief guest, and all the participants. Namaste and a very good morning to all. On behalf of the organizing committee and the Nepal Health Research Council, I would like to express my heartfelt appreciations to all the guests and participants who have graced this seminar with their presence. Your presence has made this seminar more special, and we are grateful for the time and effort you have taken to be here with us today. As per the mandate of Nepal Health Research Council Act, Nepal Health Research Council is committed to promote and coordinate health research in the country. First of all, let me express my vote of thanks to the Chief Guest, Vice Chairperson of the National Planning Commission, Dr. Bahadur Shrestha, as well as Honorable Member of National Planning Commission, Professor Dr. R.P. Bicha, for their valuable time despite their busy schedule. Similarly, I would like to express my vote of thanks to Additional Secretary of the Ministry of Health and Population, Dr. Sangita Kaushal Mishra, for her time in these opening sessions. Dr. Vasee Moorthy, who could not join here or deliver the talk virtually, for his very informative presentation and making this seminar interesting and very meaningful. Similarly, I would like to express my profound gratitude to our guest of honor, Professor Trudie Lang, Oxford University, joining the Global Health Network from Nepal. And congratulations to Nepal and especially Public Health Foundation for being the first country to establish the Global Health Network at the country level. For generously sharing the knowledge, expertise, and insight with us. Your thought-provoking presentations and engaging discussion have inspired us and broadened our understanding of the subject matter. Your passion and dedication to your respective field have left an indelible mark on all the participants. Many thanks to all the guests who are the Vice Chancellor, Dean, Rector, Chairperson of the Nepal Health Research Council, all for your valuable presence here. Similarly, I would like to thank all the presentation of this seminar, as well as chairs and participants for their valuable time. And I want to appreciate your efforts to make this seminar informative and successful. Furthermore, I would like to thank chairs of this opening sessions, Professor Dr. Heena Baral and Dr. Aruna Upreti, President of Nepal Public Health Foundation and Chairperson of Nepal Health Research Council. Similarly, I would like to express my heartfelt grateful thanks to Dr. Manoj Bhatta, who is the founder chair and the executive chief of Nepal Public Health Foundation, for his leadership to organize this event timely in Nepal and establishing the public health network in Nepal. I am deeply appreciative to all the collaborators and supporters of this seminar possible, and your continuous dedication to building the research capacity through NETL has contributed to the development of an atmosphere where ideas and information can thrive, and finally your trust and support means a lot to us. I also like to express my gratitude to all the attendees for making the efforts to come to these sessions, and your presence has greatly enhanced the conversation and transformed our gathering into a vibrant forum for ideas sharing. Last but not least, I want to acknowledge the hard work and dedication of all the members of the organizing committee, and in particular staff of Nepal Public Health Foundation for your countless hours of planning, coordination and attention, which will pay off in delivering a seminar and will exceed our expectations. Your passion for creating a meaningful and impactful seminar is truly commendable. In conclusion, I want to express my deepest gratitude to each and every one of you for your soaring support and contribution to this seminar. Your presence and active engagement will make it an unforgettable experience for all of us, and this seminar will be historical in Nepal. We hope that the knowledge gained and networks developed during the seminar will continue to inspire and empower us in our personal and professional endeavors. Thank you once again, and I look forward to a successful and productive seminar to learn and grow together. Have a nice day. Thank you.
Thank you, Dr. Dhimal. Now I would like to request our chairs of the session, Dr. Aruna Uprendi, Dr. Gehena Baral, to please share their remarks.
Very few things will remain to discuss, but when I was listening some of all our speakers, I found that few words came again and again. Community health workers, training together, information sharing and collaboration and research. And then I remembered 32 years ago when I was a very simple medical officer, without knowing that I was conducting research. It seems that I was doing research, and I was working in maternal health and in abortion issues. At that time in Nepal, abortion was illegal. So I was going in various different villages, health workers, talking to health workers, and talking to them, I just documented few cases and numbers and presented it to the government as an activist and to advocate for making abortion legalized. At that time, I didn't know that it was research, qualitative, quantitative. Someone asked me what type of research you are doing, qualitative and quantitative. I didn't know what it was. But now I came to know that it was both mixture of qualitative and quantitative. So without having any knowledge about research, just talking to people, going to health workers, it seems that we were able to do some research that really helped to make policy on abortion in Nepal. And I think that was as a milestone in my professional life. So here, when I heard that community health workers are doing good research, but they don't know. And I think that is one of our strengths in Nepal, where we had been in different places, various villages, community health workers, female community health workers, who really have good knowledge about what community is doing or what are the problems in the community, but it is difficult for them to put in words. And I think that will be when we will be doing research, when we are talking to them, that will be our responsibility to put everything in such a perspective that those type of knowledge can be and given to the government, so that the government makes, when they make policy, the government makes policy that it will be useful. And I think another it is very important when issues were raised that when we do a lot of research, but for the community, if we talk in a very difficult language, it will be very difficult for the communities to internalize the problems and they will not be able to understand. So I think that will be one of another work of Nepal Public Health Nepal Public Health Foundation to do the research and then disseminate it in such a way that people would understand, common people would understand in the community that what are the problems. I think that will really help us, our health workers, our mothers, community health workers, female community health workers, at the same time when government will make policy, that will also help them. So that this information where we have gathered from here, from our speakers, it really has given me a strength to speak and to say that yes, we will be doing research, maybe not in a very hi-fi way, but whatever we have learned, whatever we will be learning from the community, if we will be giving again that to the community, that will be our success. Thank you.
Guest dignitaries, researchers, academicians, ladies and gentlemen. First of all, I would like to thank you all for participating in this seminar. It is collaboration with the Nepal Public Health Foundation and Nepal Health Research Council. And this seminar is collaborated. It doesn't mean that we are stopping here. We are going to collaborate further research and for capacity build-up. And it will be helpful for the society and the people, and it will be helpful for our internal strength as well. And our motto is to assure quality in the country, quality of research in the country, and it will be done by enforcing international and national guidelines and directives, as well as training and capacity build-up sessions. And for this, this network will help us. And the quality itself is very abstract thing, but we have to assure it because we have certain parameters, certain benchmarks to assure the quality, because there are different directives and guidelines all over. Even our national guidelines and international guidelines, we have to follow it. We have to abide by those guidelines, and we have to enforce our new researchers to abide by national and international guidelines as well by building up capacity. And to build up capacity, it doesn't mean that only some academician researcher will do the research. Everyone is capable and potential researchers in the future, but provided there is the capacity build-up process in the place. So that is the motto for us. And whatever we do in the name of research, it has to come to the society and people. Like in health research, the clinical trials and community trial has come. Community trial and research trial, it has to be generalizable and it has to customize within the country. Research is the scientific one, we can do everywhere, we can share data scientifically, but it has to be customized with the safety of the people, of the country and the territory as well, and we have to implement within the country for the benefit of people and society. And it is our motto. It will be helpful to strengthen our capacity in collaboration with the Public Health Foundation and the Nepal Health Research Council. And we always are in favor of our young researchers to build up their capacity. We are not restricting their capacity. We are not restricting research, but we have to make it available to everyone, because everyone is the potential researchers. But we are limited by some resources and infrastructure that has to be fulfilled by our stakeholders, and our Ministry of Health is there, our development partners are there for collaboration, and our global health network is there, so that we will be capable enough to build up our young researchers and for the country and for the people. And with this, I like to request everyone to collaborate with us, to help us, and if you have anything, any complications, any obstacles from the countryside to regulate the research, you can come to Nepal Health Research Council. We are going to help you all. And we are also learning phase. We are ameliorating every obstacle, wherever it comes and whenever it comes. But it is for you and for us. So with this, I like to conclude this session. I think I thank all dignitaries, guests, and all academicians and researchers in the hall. Thank you very much.
Thank you, Dr. Opeti and Dr. Baral. Now I would like to request our chairs, Dr. Aruna Opeti and Dr. Gaynat Baral, to please present the token of appreciation and khada to our chief guest, Dr. Bahadur Shrestha. To Dr. Aliya Naheed, to Mr. Manoj Bhatta, to Professor ArunKumar Govindakarnavar, to Dr. Sangita Kaushal Mishra, Now I would like to kindly request Professor Dr. R.P. Pichna and Dr. Rita Thapa to please join us on stage to present the token of appreciation and khada to our chairs. To Dr. Aruna Opeti, tea break, so please help yourself to the tea and biscuits at the back. We will be proceeding to the first session of this seminar, which is Building Research Capacity, Challenges and Opportunities After the Tea Break. Natasha Karki, Director, Oxford University Clinical Research Unit, Nepal. Vice President of Nepal Public Health Foundation, Institute of Health Science. Now I would like to ask our chairs of the session, Dr. Rita Thapa, Dr. Jagadish Prasad Agrawal, to please introduce our speakers.
Hello, it's my privilege to introduce Dr. Meghna. He is the Chief Senior Research Officer at Nepal Health Research Council, Government of Nepal. He has received prestigious awards, including the Young Scientist Award of the year 2015 and National Science, Technology and Innovation Award of Health Sector 2022. He is a PhD in Environmental Health Sciences from Goethe University, Germany. He will speak on research priority setting in Nepal. Please, Dr. Kumar.
And all the delegates of this seminar, it's my really great pleasure to speak on public health research priority setting in Nepal. Over the last 18 years, I have been working at the Nepal Health Research Council, and I had a great pleasure in being involved for research priority settings, because research priority setting is not static, it's a dynamic thing. So we have to update regularly. So in these sessions, I will share my experience of research priority setting in Nepal. In the same time, it's equally important to know the health research governance in the country. So I will start with a brief history of health research in the country. Then we'll talk about the research prioritizing process in Nepal. We all know that the history of health research in Nepal is not quite long. If you see the history, Nepal Medical Research Committee was established in 1982, chaired by the Health Secretary in 1982. And nearly after 9 years, Nepal Health Research Council Act came in force. Then Nepal Health Research Council formally established. So Nepal Health Research Council is an apex body of government of Nepal to promote and coordinate health research in the country. So by it, the scope of Nepal Health Research Council is very different than other councils, only a regulatory body. It has a mandate to do research as well as cost to do research in the country. And if you see the function, duty and power of the council, there are the very broad function and mandate, and we should acknowledge the contribution of late Professor Mathura says, despite it's more than 30 years old. And it has given the mandate for setting the research priority in the country, giving the health research approval, and in case such research cannot be done in the country, even we have a power to provide the approval to conduct such study in the foreign country. So it has a very broad function, including formulation of the policy in both basic science as well as applied health research science. So after the promulgation of this act, if you see the Article 11, any persons or organization who wish to conduct the health research in the country should take approval from the council. Right? And in case they fail to take the approval, means council has the power to terminate such study or to even retract the paper published from such study. So there is a very strong power to the council. And not only the NHRC Act, our current constitution has also given the high priority to the health research, which state that focus on health research and keep on increasing the number of health institutions and health workers in order to make health service widely available and qualitative. So it shows the commitment of the state on the health research in the country. So if we analyze the Nepal Health Research Council Act, it has 4 major pillars or the scope or mandate, that is health research regulations, capacity building in health research, evidence generation for health, and promoting use of the evidence. And the basic aim of the Act or the council is promoting the high quality health research for improving the health status of the people through evidence informed decision making. Now let me share my experience of research prioritizing. First of all, now we are just talking about building health research capacity through network. But for me, I think we have to replace the term not building capacity. It should be strengthening the capacity. Because in the last 30 years, Nepal has made a very great progress in the health research. Let me take one example of the PubMed Index journal article publications. If you search in the PubMed database now, with using the word Nepal as a keyword, and in 1990, there were only 63 publications. And most of the publications were from foreign authors. And Nepalese author name was others in the acknowledgement or maybe a co-authors. But today, we approve more than 6,000 research proposals each year. And if you see the PubMed database, there are more than 10,000 publications per year. Just last year data 2022, 10,000. Means in the last 30 years, we made a really great progress. So, like 25 years back, we had a project from the Rockefeller Foundation, like building the research capacity. But today, I would like to say that we have already a capacity. But we have to strengthen this capacity through the networking and collaborations. So, same goes for the research prioritizations. We organized the first research prioritization workshop in 1999, inviting to the Right Honorable Prime Minister of the country, as well as Vice Chairperson of the National Planning Commissions. And we just made up 4 priority areas, right? But today, we have many priority areas based on disease burden. We are collaborating with the Institute of Health Mathematics and Evaluation, University of Washington. And based on the yearly progress on the disease burden, we are making the periodic update in the research priority area, right? And there is a great variation in the approach used to organize research priority setting, etc. And in my experience, there is no gold standard for research prioritization. And if you remember the talk of Dr. Vasee Moorthy, there is no single strategy for research priority setting because it is guided by the local context. It is guided by the research progress. And so many factors are there, even the political commitment, right? So for me, there are 3 categories of criteria against the different research options. First is the public health benefit, we have to take consideration. Second is the scientific feasibility, and finally cost, time scale, fund and stuff. And based on that, if you make a research prioritization, that will be implementable. We can track the progress there. So there are already indicators to measure the impact of the health research priority setting, like awareness level. Are stakeholders aware of the priorities and the need of reference them? Or the funding volume, right? Like changing the volume of research funding from baseline recording during the planning phase. This year, Government of Nepal made a historical decision that means allocating at least 1% of the country budget in the research, development and innovations. That means that is a clearly show the commitment of the nation toward the innovation, research and development. And same goes for the coordinations, research, translation and impact. So now we can use some tools that Dr. Vasee shared this morning, and we can track the progress and accordingly we can make a sector strategy, global action plan, global strategy. It means like normally WHO Geneva make a global action plan. And WHO Sierra make a regional plan. And normally we adopt those documents and also we incorporate our own experiences and we do the stakeholder consultation, inviting the government, academia and UN agency, and we finally set up the priority areas. So first conference named Prioritization of Essential National Health Agenda in Nepal was organized in 1998. Inviting the Right Honorable Prime Minister of Nepal as well as Vice Chairperson of the National Planning Commissions. Then we have periodically updated this in the 2005, 2013 and 2019. And again we are now planning to update this. And these documents are also guided by the milestones, for example MDG or the SDGs, Sustainable Development Goals. So normally the criteria that usually we use for the research prioritization are the magnitude of the problem, prevalence, incidence, risk factors like immune status, race and genetics, burden of disease like the dialysis or qualis, etiology, courses like mobility, disability, mortality, survival, surveillance and early diagnosis, management of control programs like socio-economic and cultural factors, health promotion and education, and political commitment. For example, sickle cell is endemic to the thorough population of the Western Nepal, but there is a high level political commitment. Even I do not request, or NHRC do not request funding for the sickle cell anemia, but our member of parliament usually put the money for the sickle cell anemia research. Means political commitment is also equally important. And these are the recent health research priority area of Nepal, 2019. So we have covered the health systems, non-communicable disease, and communicable and infectious disease. Similarly, maternal, newborn and child health, including the reproductive health, mental health and substance abuse, accident, injury and violence, nutrition and food safety, environmental, climate change and occupational health, Ayurveda and alternative medicine, and miscellaneous. And in some areas, for example, in environmental health, we set the research priority areas in 2006.
1 minute more. 1 minute more.
Okay, I'll do that. And thank you so much for listening. And if you have questions, I think still I have 1 minute. I think I can take the question now or at the end of session, that's also okay. Thank you so much.
Thank you, Dr. Meghna. Now we are moving on to the next speaker, Dr. Swaraj Raj Bhandari, founder member and the past president of Nepal Society of Obstetricians and the Gynecologists, technical director at the Reduction in Maternal Mortality Project in Royal Government of Cambodia, Master of Public Health, Major in Population and Family Health Science, John Hopkins, Bloomberg School of Hygiene and Public Health 2000, and now she is speaking on the research capacity building in maternal and child health. Dr. Suraj. And your time is 8 minutes.
First leg. I think may I request all the participants to come to the front because the front seats are empty. A very good morning and namaste to all of you. I'm Dr. Swaraj Raj Bhandari. I'll be talking on research capacity building on MNCH in Nepal. I'm very glad to see all the young researchers in this room. Briefly, I'll give you the background. I think all of us who are sitting in this room, we know about the maternal deaths during pregnancy and childbirth are more prominent in low and middle income countries. 94% of all maternal deaths occur in low and middle income countries. And Nepal has taken a great stride to reduce significantly the maternal mortality rate as well as infant mortality rate, maternal mortality ratio and infant mortality rate. And Nepal, being a signatory of Sustainable Development Goals, reveal the efforts to achieve the targets. As you can see in this slide, that I think Nepal has made a lot of improvement in the maternal health, especially that women attending antenatal care or also doing 4 antenatal visits, although WHO has put the criteria of 8 antenatal visits, but at least the 4 antenatal visits are pretty impressive, and 79% are delivering in the hospital health facilities and 80% are delivered by the skilled care providers. And most importantly, the postnatal checkup within 2 days after the delivery has also improved a lot. Despite these progresses, still women are dying from pregnancy and childbirth related complications, like 61% are still dying during postpartum period, 33% during pregnancy and 6% during delivery. And during the COVID time, 15% of maternal deaths occurred due to COVID-19. Now, there are lots of issues on quality of care, as it was published by the Nepal Health Fertility Survey 2021, that although the antenatal care coverage was very high, but only the 45% received the antenatal care services from a skilled birth attendant, and only 21% reported that they were counseled on at least 3 danger signs. And this is a real issue I think we need to focus upon, that women need to know what are the danger signs, when they need to go to the hospital, when they are supposed to touch base with the service provider. I think this area is really, really important. And there are many, many researches, like Dr. Dhimal has already presented that we have come a long way, but I will just give you some example what we have done in the past. For example, the prevention of postpartum hemorrhage, which used to be #1 killer, still is #1 killer. We were able to do the study in the community to prevent the postpartum hemorrhage at home birth and in the community. And this was scaled up and is also adopted by many, many countries. I think Nepal has taken a lead, and I am proud to be one of the PI in that study. And MPDSR is being implemented in Nepal to eliminate preventable maternal and perinatal deaths. MNS Helpline telecommunication has been set up last year during COVID time to improve the communication channel and strengthen the reference and transportation system. There is a President Air Rescue Program launched targeting pregnant and postpartum mothers to bring to tertiary care center or Kathmandu from remote areas of Nepal and from the 29 districts of remote parts of Nepal. And there are many other studies which I cannot list here. So MNS Helpline, I want to highlight few points that during lockdown, when the services were interrupted because of the travel restrictions, and there was a decrease in service seeking at the different part of the hospitals, including referral hospitals. So this study was run for 1 year, and that time the pool of experts provided real-time clinical advice to the MNH providers working in the remote birthing centers through telephone consultation during emergencies and complications. So I want to highlight here that the support from the telephone consultation shows the competence of health workers can be built up through virtual training, and it increased the confidence of and the skills of the nurses, improved the decision making during emergencies, and the timely referral was made, and it saved many women during that study period. Out of 429 cases who were consulted during that time period, 20 cases were heli lifted. Out of them, 18 mothers survived, and we lost 2 units. I think this is the area I've been talking about. We really need to focus upon how to save the units. I think this is an area which all of us we need to focus upon. Now I will just touch base upon the postpartum hemorrhage prevention. I talked about prevention. Now it is the treatment. This was during the COVID period because the woman could not go to the hospital, so we did online. I think we all became expert in the Zoom training and the Zoom meetings and all these orientation programs. So we refocused on the postpartum hemorrhage management. That is called the bundle approach. Those of you who are clinician, you would know, and those who are not also, you would know the word. Bundle approach is that you need to give injection, you need to give iodine, you need to give oxytocin, and you need to give tranexamic acid, which is a lifesaver, at the same time. And for that, you need to have a trigger, you need to have a set of actions taken immediately, you need to have a good team to work with, and supportive measure, and the logistic has to be there. So, based on that PPH management, the TXA is estimated that it could save over 100,000 lives a year globally, and deaths could be averted if TXA is given within 3 hours of delivery. So what we found was during that study, it was not study when we did the follow-up, when I was receiving the emergency call, they didn't have TXA sometimes, they didn't have enough doses. Instead of 1 gram, they would give only 500 grams, they wouldn't repeat the doses. Again, I would say this is the area where I think the research would be, again, focused on this, and Nepal Public Health Foundation did send a proposal on this, but unfortunately that research was not accepted. But however, I would still request all our younger generation to study on this bundle approach with PPH, whether it is being implemented properly or not. Training is not sufficient. I think implementation is more important to save a woman's life. Now, there are many challenges in health research. I think we have been hearing this from morning. Although Dr. Dhimal has presented a very positive aspect of the improvement in the research area, but I would see we face lots of challenges at the national level, at the institution level, at the human resource level, health systems level, individual and community level. Because I think there is a financial constraints, there is human resource constraints. I think these all we know, we are aware. Now to overcome these challenges, we need to produce research evidence useful for reducing burden of maternal morbidity and mortality. It is very important to do operational and the implementation research. As a result, the effectiveness of the research needs to be looked up. For further scale up, effective research leadership and mentors are required and need to build international networks of researchers for reciprocal learning. The take-home message is that we need to inculcate research culture among all the students, not only the in-service but in pre-service as well, focus on quality of services, and I would really urge to work on the neonatal survival. Thank you very much for your kind attention.
Thank you very much for such a nice presentation. We will take the questions at the end of the session.
Research Fellow, Oxford University, Clinical Research Unit, Vietnam. Oh my God. Doctorate, she is a doctorate in clinical medicine, University of Oxford. May I please request you to proceed with your presentation, research capacity building in infectious diseases. Thank you.
Thank you everyone. So I'll try to cut it down to 8 minutes because I thought I was getting 10. But so I'll be especially focused on infectious diseases. So I work with the Oxford University Clinical Research Unit, which is basically hosted by the Department Academy of Health Sciences. And we've been around for about 20 years now, 20 plus years. And basically what we do is work on infectious disease. And we have in the past been clinically based. So a lot of the things that we've done in the past is clinical research. But I think as research has shown us, we're going slowly towards public health research nowadays. And our main mission is actually to strengthen, build a mass of young, not just clinicians, but scientists and paramedics and social scientists, everyone who's in the field to make an impact on healthcare regionally as well as globally. Now I think this is, being in Nepal is, we've got the stacks, of hardships against us. We're in the Intergangetic Plains that I think everyone knows has the largest population in the world, is the region that is most prone to climate change, and with that comes a massive role change in infectious diseases. So most of you might have seen this picture, but this is a photo that was taken during the COVID lockdowns, and it was taken from the southernmost tip of Nepal, and you can see Mount Everest, which is our northernmost tip. Now, if you look at this photo, you see the diverse geography that our little country has. And I think that topography makes a huge change in infectious diseases that each region faces. So what the north finds is their top priority might not be the priority in the south. So, how do we go about doing this? And when you look at Kathmandu itself, Kathmandu is not the city that I was born in, not in terms of climate, not in terms of population, not in terms of infrastructure. So in these changing times, have health priorities changed? Should they change? I think we're struggling as a country. I mean, I've got a little bit experience, but I think we are struggling, especially when you take climate change, especially, and its relation to infectious diseases. As we saw with COVID-19, Nepal struggled, like the rest of the world, but I think we struggled more. And last year, we saw our biggest outbreak of dengue, and I think dengue is here to stay. And despite all good efforts, research going on, the population did suffer, but with that, I think, came a lot of opportunities. So for COVID-19, UCRU was involved with the largest COVID trial recovery, which together with the Nepal Health Research Council, we have been able to do nationwide. And actually, a recent Lancet publication, Nepal was the country that had the largest enrollments for this study. And now we are actually thinking of turning the COVID platform, the recovery platform, into a dengue platform to collect data. And the reason we were able to respond to COVID-19 by doing a clinical trial during COVID pandemic was because we had a platform. So we had a platform, we had people who had been trained. We worked very closely with the Nepal Health Research Council, who has a wide network. And I think what we learned at that time is that it is extremely important to have a platform for research, and not just a platform, but something that is quite sustainable. It is something that we ourselves, even after 20, 25 years, are struggling with. But one of the greatest things that a country needs, if you need to do research, not just clinical, whatever you need to do, I think you do need a sustainable platform with trained people in there that is consistent. In terms of clinical trials, I think UCRU at the moment has become a useful platform where we've been able to change therapies, we've been able to put vaccines into national immunization programs, but that has come out of after years of building up on making sure that we get out reliable data that is globally accepted. We ensure that all the data, all the scientists are quality controlled. And one of the biggest achievements I think we've made in the last 2 years is funders are very keen about how their money is spent. And I think financial accountability and transparency was a huge issue for a lot of funders and sponsors when they came into Nepal. First, because we didn't know how to do it, what they wanted. But now I'm happy to say that after about 3 years, we've been able to build our finance department up, and they're part of the Good Financial Grant Practice, which now they've got accredited for. So basically, it just means that the funder or a sponsor is sure that their money is going to be spent with a lot of transparency and accountability. Now, one of the things that I did say is we put typhoid vaccine into, we showed its efficacy, we put it into the national immunization program, but then the disease is still around. That's what I meant when I said now we are thinking about going into a public health study is how do you stop the disease? You've got the treatment trials, you've got the vaccines, the government has put in new sewage pipes and water pipes, but how do you get the cycle to go away? So that is something that we're thinking of working closely with the community and the public health. And one of the things that we've learned is to reduce morbidity and mortality, of course, you need all the health aspects, but I think working with the community, community engagement, has been a huge factor of what we do. I think all of our clinical trials and our vaccine trials would not have been successful if we hadn't had the sustained, continued conversations with our community. So what we do at UKRU is a lot of school engagement. So we've got a community engagement team that goes to schools, that goes to communities, talks about diseases, asks questions about what it is that they want to hear, learn about, etc. At the same time, we also have master's and PhD programs that we've tried to set up to help and train people in doing research or basically just doing what they're interested in. And we do a lot of exchange programs with our collaborators, so we might get a few students from Oxford or Princeton into Kathmandu, and the Nepalese students go off to Princeton or Oxford for some exchange programs. And I'm happy to say that when I came to Nepal in 2008, there was not a single person, at least in the UKRU environment, who was able to write a competitive grant. But at the moment, we've got a lot of people who, even in this audience who are sitting, Sulochana, who's put in really good Welcome Trust grants and competitive grants that they fought for. We, at the moment, lead a regional treatment trial that's led by Dr. Buddha Bosnet. But we lead the region in treatment for typhoid. However, despite all of this, there is a brain drain. There is a struggle in retaining good people. Once you train them, they become very good, then they leave. We have had instances of where we've trained them, people have left, but then they've come back. But the problem again has been we still haven't been able to retain them. Eventually, they do leave. And then there's also, so we work very closely with government bodies, and one of the problems that UKRU faces is, government, whoever you're working with in the government sector, they move around, they shift. So you train, you work together for 2-3 years, and then they move. So you've got to start the cycle all over again, which I don't know how we manage it, but I think it has to be a conversation where we discuss how we need to manage it. And diagnostics is a big problem in the country, so that's something that we work very closely with CMTN and other laboratories, the NPHF to upgrade. But however, there are limitations. I think funding digital resources is the other huge problem that we face. Everything is in handwritten ledgers. So getting any data out in the digital resources is very limited. But not everything is bleak. I think there is a desire to change. The Patna Academy of Health Sciences has recently started their infectious diseases residency program, which I think will help infectious disease in the country more. And there is a desire to change. The Britain Nepal Medical Trust is someone we work very closely with, who do a lot of TB work, and just doing things out of the box. So we are trying to use drones to get TB samples in and out of examination sites and see if we can get medicines through. But this is a work in progress, so without taking much time, I'd like to say thank you.
Thank you very much. Can we invite another speaker, Dr. Lochana Shrestha. She is the Professor and Head of Department of the Community Medicine, Nepalese Army Institute of Health Sciences, and she is the President of Nepalese Society of Community Medicine, and she has the Master's degree in Community Medicine, University of Sydney. Dr. Lochana, please.
respected chair and co-chair of the sessions, and my dear respected audience. First of all, I would like to thank this organizing team to give me this platform to talk about the geriatrics, which is very much close to my heart. Being working for the geriatrics for the last 15 years, I'm very happy to talk about the geriatrics, and I hope that everywhere give the chance to talk about the geriatrics, and everybody will come forward to work for the geriatrics. I'm just highlighting here about the research and capacity buildings for the geriatrics, our situation in Nepal, researches, capacity buildings, and why it is important to look into this aspect and what we can do about these things for the geriatrics. Research capacity building is systematic efforts and strategies that aims to individuals and institutes and communities to conduct a high quality and impactful research in the field of geriatrics. After this, I just want to highlight why this research and capacity building is important for the geriatric. I just want to highlight by the point wise like that. We all know that there is a population aging is going on, which has increasing implications in the economic, over the world as well as in our country also. Another thing is, we all know the elderly people are very much vulnerable in all aspects, and we all have to think about that, and we all know that there should be the goal of the development of the evidence-based practices for the policy development for the geriatrics also. And we all know the problems among the geriatrics is very much preventable, and we could do the actions for the prevention among them. And another strategy should be that early diagnosis and treatment is very much important for the geriatric groups, and that should be the evidence-based, and we can bring the better outcomes to work for the geriatrics. In this regard, I just want to highlight in all the components in these points, like population aging. We all know how the population is increasing worldwide. You can see the figure here. And also in the last one line I have said, in 2018, for the first time in history, persons with more than 65 years is overcome by the children aged under 5 years. Now we can see how it is with the number of population in future. In Nepal also you can see figure how the number of elderly is increasing. It was before 2011 8.1% of the population. Now you can see census 2021 brings about the 10.2% of the population is the geriatric ones. Then we can see in the future how much it is the geriatric population. Now, we all know among the geriatrics how it is increasing the comorbidities also. CDC has declared that there are 10 diseases which are very much common among the elderly, and among them the chronic health conditions, diabetes, hypertension, osteoarthritis, ischemic heart disease, these are the chronic health conditions. Among them now it is dementia is also increasing among the elderly. And just I want to highlight that this chronic health conditions brings about the low quality of the life in the elderly, and also contributing to leading causes of death. The WHO has given the figure that 50% of the elderly having any type of one of the chronic diseases, and more than 25% of the elderly having comorbidities, more than one type of chronic disease. That's why this shows that how much the chronic diseases is increasing among the elderly people. This also shows that one of the cognitive and neurodegenerative dementia is very much increasing among the elderly populations in our low-income countries and in the worldwide also, and it should be the public health priorities. And I just want to highlight here, and I want to show you all that how this is implicating. Population aging is how, in what aspect we have to give the importance to deal about this population, because it has combined with the increasing comorbidities, along with that increasing the economic implications also, because to deal with all the problems among the elderly, with the cost up to that is more than other things. Like, so I just want to give the example of the dementia cost, how the dementia number is increasing worldwide and how the cost is increasing to deal with this dementia worldwide is very much eye-opening to this part of this thing, because the economic implications to deal with the problems of the elderly, making the people all over the world to giving the importance to deal with the problems of the elderly, because the economic implication is very much important in this aspect. You can see how the number of the dementia is increasing, along that how much the cost is increasing to deal with the dementia. That's why this is the one of the example which I have given you. Now if I give all of the examples, and it will be more time, that's why this one. You can see this one also, how the cost is in the dementia. Number of increasing the dementia, the cost also increasing, but you can see in the last, in the graph, how the research activities is also increasing in relation to dementia. Now, in related to talk about the vulnerable, why the elderly people are more vulnerable? Because of this underlying condition, physiological changing, comorbidities, and even declining immune systems among the elderly. And we can see in the COVID-19 also, COVID-19 how it is the death is increasing among the elderly because of this combined comorbidities also. That's why I want to for that there is not the typical elderly people. They are in relation to health, because we have different problems among the different elderly peoples, and we have to deal differently with the elderly people. That's why there is a need of evidence for this to deal with the problems for the elderly. Now, global strategy and action plan also have given some areas of data and research and regarding so many aspects, and also at the last in the 5 number they have given the research is required to bring about the strategy into actions for the elderly. Along with that, I just want to highlight World Health Assembly 2020 also declared the decade of the healthy aging, which has come out with the 4 action areas. You can see here 4 action areas, but all these actions to be bring out with the quality outcomes, we need the evidence, we need the research, which is little bit, it's not mentioned in this action, but we all know for this action to bring out very effectively, we need the research in all aspects. Now I just want to highlight what is our initiative in our Nepal, and researches and all. We all know in Nepal so many acts and rules, everything guidelines, and everything is going, it is there. And Constitution of Nepal also, Article 41 also shown that there is importance for the rights of the elderly, and also now recently home-based care, geriatric care center implementation, senior health service program implementation, and 78 that's why health services strategy. These are the things which we have. And regarding researches, there are very limited data in the physical, mental and casual peoples. I have seen and I have shown that after seeing the databases which has shown that only the 49 articles are there in working for the geriatrics. This is the published articles, and it is working by the Nepalese people, and they have conducted in Nepal. That was the inclusion criteria, and it has found that only the 49 articles are there. And largest articles only focus on the depressions and quality of life. That is all social studies and in relation to cognitive studies and all. Like see, so many descriptive studies are also only here, like dementia. Dementia only there is studies of very limited. And also 1.9% only. All are very limited by small and non-representative samples in constitute all measurement tools. And also one of the biggest, there is no validated, and also the measurement tools is available in Nepal to conduct research, which is very much important to develop. And regarding challenges, we all know there is a very limited accessibility and availability healthcare service system, limited age-friendly communications, and supportive environment is lacking in relation to data and research. It's very limited data, and everywhere the limited address in policy, planning, platform, and implementation. Whatever I have shown before, the guidelines and all strategy and all, they have very much highlighted about the research in relation to geriatrics. Even the health strategy in geriatrics 2017, it has not shown about the importance of the research in that strategy book also. Limited research, and and another one is very much limited trained human resources is there in Nepal, which needs to be focused. and building the aging research were not addressed anywhere. That's why I just want to, that we all have to focus on that. I hope everybody will give the priority area in this things. Now, in relation to this, how to develop the research capacity in geriatrics, first we need the training and education, mentorships and collaborations, infrastructures and resources. We all know that. We all have to be focusing there. And research fundings and grants, dissemination and translations, advocacy and policy supports, evaluation and monitoring. These are the 7 components which needs to be highlighted to conduct the research and research capacity buildings for the geriatrics. United Nations Development Programs also has declared the 6 areas for the institutional level capacity buildings for the geriatrics. By building the research capacity, we can develop the strong and sustainable research ecosystem that address the unique needs of the older adults and improves the overall quality of care provided to elder people's health with the economic stability, which needs to be focused.
Gentle reminder of time. You are already 2 minutes.
And these are the proceedings which we can recommend it. Like we can declare the decade of capacity buildings. Under that, we can develop the national strategy for aging, and also government bodies like Department of Health Service, NHRC can come their coordinations and collaborations. And also we can think about there are so many university research systems, we can bring about this platform for the collaborations. And also we can develop the research network on aging, bringing about the partners, emerging researchers in aging initiatives. We can do the virtual seminar series, and also national dementia initiative and institute. These are the things which we can do for the research capacity buildings. And I just want to give one of the examples which is going on in Nepal in the Chitwan. The Chitwan Valley Family Study of Cognition Aging in Nepal, which is going on in study in Chitwan Valley regarding study in the dementia and the assessment tool, which is one of the examples of the collaborative studies.
I think it's better to wrap up because we are...
Okay, finished. And also in the South Asia, there is one of the collaborative studies that is the roadmap for the dementia research. In the conclusion, I just want to think that being that Nepal is the low-income middle countries, the burden of the different problems are elderly and most important risk factors is currently unknown, in part due to the lack of the existing research activities and research infrastructures. Addressing the needs of the elderly population is the challenge that requires the joint approach and strategies for the collaborations to work. And failure to address this need today could develop into costly problem with disaster tomorrow. Saying this, with growing population of the older people, let's ensure we are not only adding the years to life, but life to years with action, evidence-based actions, not only policy. Thank you.
Thank you, Dr. Rochana. Now, may I invite our last speaker of this session, Dr. Madhur Basne. Sometimes we call him Madhur Basne. He is MD from P. Koirala Institute of Health Science, Dharan, and he is Associate Professor in the Department of Psychiatry at PPKIHS, and he has led a very interesting movement, health politics movement in Nepal, and that contributed to policy making. Dr. Madhur Basne, please go ahead.
Thank you, respected chairs and distinguished guests in the audience. I would like to thank Dr. Vasee and NPHF for providing a young, aspiring mental health professional like me to provide this opportunity to share some reflections on mental health research capacity building in Nepal. This photo shows the auspicious tradition of welcoming guests by 5 young girls, also known as Panchakanya, which is supposed to be very auspicious, and I hope that this day of inauguration of the Nepal Hub of Global Health Network would provide and prove to be be a milestone event in research capacity building in Nepal. Namaste and good afternoon. I come from this beautiful campus called BPK Koirala Institute of Health Sciences, which is also the leading institute for production of health research, literature and publications in Nepal. So, being the last speaker, we are usually, we lack time, but I will try to finish on time. So, I'll briefly discuss the current status of mental health research in Nepal, followed by brief reflections on mental health research capacity building and challenges and opportunities. So the history of mental health in Nepal is, modern mental health services in Nepal is relatively short, with just around 60 years of history. That is started with OPD services in Bir Hospital by late Dr. Vishnu Prasad Sharma. And the first recorded literature on mental health research publication I could find on internet was by Dr. Sharma himself. That shows the object in which he published the observations of the patients following vasectomy in Nepal. And following that, it took almost 1.5 decades for the first community-based mental health research that was conducted in 1984 in Kathmandu Valley with the support of an NGO. And then it took almost the next 35 years for the first national mental health survey that was completed in 2020 and conducted by Nepal Health Research Council. And the major findings of this mental health survey were the lifetime prevalence of mental disorders among adults was 10% and current prevalence of 4.3% and suicidality of around 7%. Similarly, among adolescents, the prevalence of mental disorders was around 5% with suicidality of 4% and the suicidality seems quite high. And also it shows that only 23% of them sought treatment for their symptoms and majority of them contacting non-specialist doctors, which are usually available nearby, followed by faith healers and psychiatrists. Another major public health mental problem in Nepal is suicide. Suicide is the leading cause of death among women of childbearing age. And the leading cause, it was also found to be the leading cause of death. That is almost 2/3 of the females of reproductive age group who had undergone autopsies in major health centers in Nepal. And in the last fiscal year, Nepal police reported 6,830 deaths to suicide, which comes out to be the crude death rate of around 23 per 100 population, and that's again quite high. And another major issue that is often overlooked in Nepal is the migrant workers. In the first 10 months of this fiscal year alone, 660,000 Nepalese, mostly young people, have gone abroad for employment. And suicide is the third leading cause of death among them after cardiac arrest and road traffic accidents. And in this background, there are some major research projects that have been taken in mental health in Nepal as well. And this is just a few of the highlights. And one of them is the community mental health program that also undertook not only the mental health service to the community, but also conducted some community researches as well. That was done by Department of Psychiatry TVTF in the 1990s. And some major mental health research projects of international importance were like PRIME and Emerald and RESET that were mainly conducted through TPU Nepal, and these were the projects in collaboration with various international agencies. Similarly, depression identification instrument development for South Asia that was conducted in BPK, and not to miss this Hope Grid Nepal project conducted by Nepal Public Health Foundation on highly hazardous pesticide poisoning. And the recommendations of the findings of this research was also impressive, and banning of highly hazardous poisons pesticides after the finding of this research has led to reduction in these highly hazardous poisoning deaths as well. So coming to the challenges, most of the challenges in mental health research are similar to that of the challenges highlighted by the speakers previously. So one of the major challenges is lack of research culture in general as well as in academia. Research in academia is mainly limited to raising thesis and research for promotion by the faculties, and mostly there is no protected time for research activities. Similarly, lack of qualified manpower and poor research funding opportunities have already been highlighted by the previous speaker. This slide shows the mental health resources in Nepal, and you can see here only around 0.2% of total health budget was allocated to mental health, and almost non-existent fund for mental health research by the government, besides some fund through the Nepal Health Research Council. And also we can see here that the number of mental health professionals is also very less in Nepal. Other challenges that have been highlighted is like administrative hassles of research fund mobilization when the researchers acquire funds from international agencies. Researchers have complained of hassles, some hassles in Social Welfare Council, NHRC and universities as well. And similarly, poor research object findings in policy planning and programs that have been already highlighted as well. And I think another major challenge in mental health research in Nepal is the huge diversity in population and geography, with 142 ethnic groups, 124 mother tongues and 10 religions within this small area, 147,000 square kilometers, and with terrain ranging from highest mountain in the world to the sea level. But behind every problem lies the opportunity, and it depends upon us to change these challenges into opportunity. So one of the major opportunity and motivation for people who are interested in mental health research is relatively nascent field. Like there is, as highlighted by earlier researchers as well, in mental health also, actually research in mental health is relatively lagging behind all the fields of medicine and health. So we are likely to be the first one in this area. Similarly, recognition and prioritization of mental health and mental health research by the government, and NPHF Vice Chair himself committed for that research support. Similarly, increasing interest in mental health research and increasing build-up of research capacity. And this huge diversity actually could be an opportunity for understanding the effects of socio-cultural and geographical aspects of mental health and genetic studies as well. And there is increasing recognition of the need of justice, equity and inclusiveness in mental health research by major global funders. So, and of course, and this opening up global health research network would provide another opportunity. With this, I would like to end by saying that collaboration is the key for this. So, I am in presentation here. Thank you. Thank you.
May I please invite the floor for a few questions. Given the time constraint, I request you to be very precise and focused. Thank you.
I'll start. I'm Sabir Dixit. I head the CMDN and also I'm a General Secretary of NPHF. I have a question. It probably goes to NHRC, but then it kind of adds on from the other speakers' comments and presentation. I'm a researcher, so sometimes I have a question as to who do I answer to. If I'm a health researcher, NHRC has its own mandate. It's supposed to support research and it's doing a good job. But then the last speaker mentioned that also Social Welfare Council. It seems to be a new player in the field and it has all of these different questions. Some of those are not even related to health research. We have to answer to that. And then there's the district health related offices, which also are, or even at the provinces level, they ask for questions and they ask for letters. So my question now is, if a researcher, if we work with the consortium and develop all this partnership that we're trying to develop, we develop proposals, submit it, and all of a sudden, if we're required to submit all these different documents, pay not just the the documents, but also pay all this different money. How will the research progress in Nepal, and how will NHRC promote health research in the country with all these things playing in our mind? So is there a way that NHRC can play a focal role of being the only entity that attends to everything else on behalf of the researchers, and not have the researchers go through all the hassles and thereby wasting money, time, and also motivation, and make us look really bad in front of our international collaborators if we have networking this. So that's my question to NHRC. Thank you.
I am Vasee Moorthy, Professor of Microbiology.
Just a minute. Let's finish with the question. First question.
First of all, let me thank Dr. Samir for raising a very important questions. As a researcher, I have also the same feeling. But as a head, as a representative from Nepal Health Research Council, my response will be different. That means, yes, NHRC has the act, it has the mandate, we have to follow. In the same time, Social Welfare Council has also an act, and we have to follow. Means, if you register your organization as an NGO, that means your umbrella organization is Social Welfare Council, because they oversee the everything. And if you do the like public health program, like awareness program, you don't need to come to NHRC. It's perfectly fine. But if you are working in the health research, means you have to take approval from both parties, Social Welfare Council and Nepal Health Research Council. You have to respect the rule of the nation, state. And if a researcher like you, me, and many have the same problem, that means act is not rigid. We can change. Let's raise the voice in Parliament. We need to convince to Parliament, right? And we can change. And I will share the good progress. Couple of years back, Government of Nepal drafted a policy, that is the National Research Policy. Unfortunately, it was led by the National Planning Commission, but so far not finalized. Because there are so many hurdles for that, right? And currently, Government of Nepal is formulating a new bills, that is National Act on Research, Development and Innovations. And they are taking the feedback from all council and other things. And let's hope that act will remove the barriers and will facilitate the researchers. So it is not only by Social Welfare Council or by NHRC you are suffering, but by the law of the country. And that mandate is only to the parliamentarian, member of federal parliament. So let's raise the voice, they are not here. Thank you.
Thank you. Dr. Lisa, you had a question.
Nepal Public Health Foundation and the Global Health Network Center for building health research capacity to networks. I am not particularly focusing to any individual speakers. I am focusing to the generally this collaboration in the globally and the also nationally will improve the research capacity of the researcher because this we have a very less time given during the training in the masters and the other program or the research training. That is one we have to consider this global health network and Nepal Health Research Foundation. And there is one very important warning issue regarding the drug medicines, which has not been addressed in this forum. So I suggest to come for the drug medicines, also one of the burning issue. WHO also already declared about it. Another one is infection prevention. This has to come one of the important aspects in our training and collaboration. Thank you.
Thank you, Dr. Jal. Now we would like to have the specific questions. If you have to any speaker, you can introduce yourself and you can have the specific question. Any other question? Yes, please. Mike, then Mr. there. Okay, fine.
Good morning, everyone. I'm Sangita Kaushal My question is primarily to Dr. Manoj Bhatta. So most mental health disorders and issues go undiagnosed in Nepal, especially in rural areas. My question to you is that how do we as a network strengthen mental health research when a lot of disorders are undiagnosed and a lot of people live their lives with undiagnosed mental health disorders, which eventually creates a huge data discrepancy. So how do we as a network strengthen that?
I think one of the major issues to address this is, it has been already taken up by the government as well, that integration of mental health services into primary care is one of the strategies that Nepal government has taken to provide mental health services in the rural areas as well, which are usually underserved. Similarly, we need to conduct other researches, basically implementation research on whether this strategy is effective or not, and what other effective strategy could be to provide quality mental health services to people in these relatively underserved areas. But one of the strategies that is already being taken up and implemented by the government is integration of mental health services in primary care. And this year, I think 65 of the districts have reached this integration program. But of course, this is in patching only, so that needs to be scaled up as well. Thank you.
Thank you. I think we have covered most questions. The last question which the young lady is asking there, yes.
I have two questions, and one is specifically for Dr. Manoj Bhatta. Sir, in your slides, you have mentioned the ethnicity as a challenge. So I would like to know why you would consider it as a challenge. Is it due to cultural barrier or cultural differences or language barrier? Can you please elaborate?
And what is your next second question? If not, then he will answer your question.
Okay, my second question is for the whole panel. So lion's share of global health funds are usually from the high-income countries, and also a lot of global health research centers are located in high-income countries. So do you think this has muted the local voice and lack of long-term investment infrastructures that has made our local institutes and researchers ill-equipped to find local solutions to local problems?
Thank you, Dr.
Thank you for your question. Regarding why I said this as a challenge is basically we need tools for research, and in mental health also, like, we don't have specific, we do have tools for mental health researchers, but most of them are developed in earlier other panelists also said that these are developed in other cultures and developed nations. So validation of these tools in our context and adaptation of these tools in our context is really challenging, and this cultural diversity and ethnic diversity poses more challenge for that. And this is indicated by these findings of the National Mental Health Survey 2020 as well, because it found the findings of the survey was skewed in some of the provinces, and that led to the overall data analysis problem in overall data analysis as well. So I think Dr. Naheed also could highlight more about this, but that's my answer. Thank you.
I think there are 4 questions still left to answer. Let me answer very quickly. First question is networking and collaborations. We have already started. That's a very productive publication, more than 10,000 per year. For example, recently we completed the National Matter Mortality Study in close collaboration of the NHRC, Ministry of Health and Population, and Central Bureau of Studies, National Studies Office, right? And all the development partners were there. So now we have 150 per 1 lakh live documents, rigid data from census data. Second example of the different trial during the COVID-19, like the recovery trial, in collaboration with the Oxford University, Vietnam, NHRC, and others, right? Second, your question is about the drug resistance of Professor Bhatta. Yes, that is well incorporated in the priority area of NHRC. My last 2 answers to yes. Your question was about the language barrier. Yes, there are so many language barriers in research. let's say in the National Mental Health Survey, in the Madhya province we got a very low, and sometimes it was very difficult for us to publish. But we acknowledge that because of the language barriers and stigma, we got a very low prevalence as compared to the national level. So that we need to acknowledge and we have to plan accordingly. For example, in the recent National Demographic and Health Survey, we have a tools in Maithili for the province too, means Madhya province, right? So that is another important, and I think all are answered now. Thank you.
Now I think we are almost at the end of the session, so our chair, Dr. Thapa, is going to give her remarks and then finally we will wind up.
Amazing, amazing, you know. I am a very old public health worker, very ancient. Today what I have heard here, all the presentations, we really have come a very long way. And thanks to all the distinguished speakers for your very valued presentation that are very critical for our health from womb to toe. We have covered from womb to toe, including our lifestyle related problem, modernization, that is mental health. So I like to give a big hand to all the speakers joining in this. Why I say that we have come a long way? Because I come from the time I was hearing Dr. Swaraj's presentation on maternal mortality. I worked at the time when maternal mortality was something around 1800 or more. And today, 151. I mean, the list goes on, you know. We have our health mileage has been very impressive. But there are some shadows which I would like to, this morning, I think Professor Trudie touched briefly on health inequity. And also Dr. Sangita Kaushal Mishra touched on gender. You know, these are very important issues for research, and because it affects all our life at all domains. Having said that, you know, I just like to give you some information on as an example. Like for example, maternal mortality at the national average is 151, which sounds very good, you know, but we should not be always, be at that stage. We should look beyond that. What is the maternal mortality ratio between the urban and rural areas? What is the child mortality ratio? What is the neonatal mortality ratio at that level? And there is a big difference. I don't want to go into the figures because we don't have time. Now, why I raise this question? Because Nepal constitutions wants every citizen have improved health. Every citizen have access to quality health care. But this kind of gap is a big impediment. So, SDG 3 targets, you know, these are very huge targets. Like for maternal mortality, we like to national average 151 to 70. Okay? And NCD is the rising cause, the number one cause of mortality. And NCD to reduce, to achieve the SDG goal 3 by 1/3. Now, with this such a gap between the rural and urban area, it becomes a very heavy task for us. But at the same time, this huge task also has given us a huge opportunity. You know, I noticed that 4.95% of total health sector budget is allocated to SDG 3, which is great, you know. But I think, in my opinion, money is not the only thing. We should know how to utilize, where to utilize, what is the cost effective, where is the investment we should put in this funding. I think in this, I request Dr. Meghnad, which is the main apex research body of the government and Ministry of Health, to advocate a significant proportion of this 4.95 project allocated for SDG on this ongoing research. Research that, especially I emphasize, research, community-based research with focus to narrow the gaps between the rural and urban communities. Now, sharing from my own experience, I have many hats. One of my hats is Public Health Foundation, but the other hat, which is continuing hat, is I am the founder of, president of Bhaskar Tesli Memorial Foundation. And in that capacity, as a pro bono investigator, we did a research on one question: can you reduce the risk reduction, NCD risk reduction among school adolescents? And surprisingly, we were surprised. We did very significant, statistically significantly. And this research has already been published in Global Heart Journal. And recently, I'm not bragging, but this is a fact. Recently, this research has won the Health Minister Bloomberg Public Health Award because of its very significant reduction. It is a research. Now, I'd like to share with you what made it happen. Very briefly, there are, we applied as Professor Trudie said this morning, we applied directly at the community. We started working with the community. So, the three factors I want very brief. One is the partnership between the government, community, and the NGO experts like anyone, okay? And secondly, using the locally available data, the data that makes sense to the local community, okay? And the third was trying to change the behavior, because behavior change is, I believe, is the best medicine for true health. Lastly, BDMF is now working on how to reach the unreached. Our problem is how to reach the unreached population with the evidence-based interventions, even provided by our health facilities. They have not reached to many populations in our country. So I think the challenge, the research is how to reach those communities. Generally we can achieve SDG. So in this, I'm trying as a BTMF, I'm happy that we have this global health network. I will be more than happy to welcome any partner if you like to come and help me support this. I will be very grateful. With this, thank you very much.
Thank you. Now we are at the end, and our chairperson has most of the things has been summarized. I too like to thank all the speakers for their very remarkable presentations. At the end, I would like to just say a few words in relation to our networking. We have the networking at the global level, we have the networking at the Asian level, we have the networking at the Nepal level. So today we have launched a new the Global Health Network Nepal. And the priority should be like we discussed, Dr. Losna said about the dementia, Dr. Madhu said about the suicide and all those things. Now, do we need to find the innovative research, innovative methods, innovative things to bring out the positive result in the society? Like for example, I just share one or two examples. Nowadays, most of us who are sitting over here, we may be doing the intermittent fasting, which was there for thousands of years when we never paid attention to it. But now, as the research brought it, again that no, it is very good thing. So I think Nepal is one of the countries which can contribute to the world by giving these innovative research which are proved otherwise. But we need the research to give the evidence to the world. So I think certain things which are mentioned in our Vedas and in ancient literature, they can be researched with the positive impact. And nowadays we are saying, you must be all be saying that even the prayer works for the disease cure, where the affirmations they help for the disease cure and all those sort of things. So I think some sort of percentage of the research should go on this way. And now the spiritual approach to the health. Spiritual approach to the health should be one of the priorities of the Nepalese Research Council to look into that and motivate our young researchers for that. Finally, thanking everybody, we would like to take our leave. Thank you very much.
Thank you, Dr. Thapa and Dr. Agrawal, for your remarks and moderating the session. Thank you, our respected speakers, for your esteemed, captivating and enlightening talks, and the participants for your questions. Now we would like to ask the chairs of the session to please present the token of appreciation to our speakers. I would like to request Dr. Suniti Acharya, founder member of NPHF, to present the token of appreciation to Now I would like to ask the chairs of the session, Dr. Rita Thapa and Dr. Jagadish Agrawal. And Dr. Bahadur Shrestha.